Welcome to today's video where we'll be diving deep into megacolon, a serious condition affecting the large intestine. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. So, buckle up as we navigate the complexities of this digestive disease. The causes of megacolon are diverse. It can be congenital, meaning present at birth, as seen in Hirschsprung's disease where nerve cells are missing in the colon, preventing proper muscle contractions. Acquired megacolon can result from inflammatory bowel diseases like Crohn's disease or ulcerative colitis, ischemic colitis where blood supply to the colon is reduced, or even certain medications, especially those that slow down bowel movements like opioids. Chronic constipation can also contribute to the development of megacolon over time. Understanding the underlying cause is crucial for effective treatment. Now, let's discuss the pathophysiology. In essence, megacolon involves abnormal dilation or enlargement of the colon. This dilation disrupts the colon's ability to effectively move stool, leading to a build-up of fecal matter. This build-up stretches the colon walls, further impairing muscle function and creating a vicious cycle. In cases like Hirschsprung's disease, the absence of ganglion cells prevents peristalsis, the wave-like muscle contractions that propel stool, leading to chronic obstruction and dilation of the colon proximal to the affected segment. While precise epidemiological data for all forms of megacolon is challenging to gather, we do know some specifics. Hirschsprung's disease, the congenital form, occurs in approximately 1 in 5,000 live births. Acquired megacolon is more difficult to quantify as it's linked to various underlying conditions. The prevalence of inflammatory bowel diseases, opioid use, and chronic constipation play a significant role in the incidence of acquired cases. Certain populations, particularly those with limited access to healthcare or those with underlying chronic conditions, may be at higher risk. The signs and symptoms of megacolon can vary depending on the underlying cause and the severity of the condition. Common symptoms include severe constipation, abdominal distension or bloating, abdominal pain or cramping, nausea, vomiting, and in some cases, fecal impaction. In infants with Hirschsprung's disease, symptoms may present as failure to pass meconium shortly after birth, vomiting, and abdominal distension. Recognizing these signs early is critical for timely diagnosis and intervention. Diagnosing megacolon usually involves a combination of physical examination, medical history review, and diagnostic testing. Abdominal X-rays can help visualize the dilated colon. A barium enema, where barium is introduced into the colon to improve X-ray imaging, can identify areas of narrowing or obstruction. Colonoscopy, a procedure where a flexible tube with a camera is inserted into the colon, allows for direct visualization and biopsy. In cases of suspected Hirschsprung's disease, a rectal biopsy to check for the presence of ganglion cells is essential. Megacolon can be classified based on its underlying cause. We already mentioned congenital megacolon, primarily Hirschsprung's disease. Acquired megacolon can be further categorized based on the etiology. For instance, toxic megacolon, a severe and life-threatening form, is typically associated with inflammatory bowel diseases like ulcerative colitis or Crohn's disease, and is characterized by systemic toxicity. Another type includes pseudo-obstruction, which mimics a mechanical obstruction, but without any physical blockage. Understanding these classifications is important to guide the specific treatment approach. Treatment and management of megacolon depends heavily on the underlying cause and severity. For Hirschsprung's disease, surgery to remove the affected segment of the colon is usually necessary. For acquired megacolon related to inflammatory bowel disease, managing the underlying condition with medications like corticosteroids or immunomodulators is crucial. Enemas, stool softeners, and laxatives can help relieve constipation. In severe cases, colon resection, surgical removal of a portion of the colon, may be required. Bowel retraining and dietary modifications, such as increasing fiber intake, are also important components of management. Unfortunately, there isn't a straightforward way to completely prevent all cases of megacolon. However, certain preventative measures can be taken. Genetic counseling may be beneficial for families with a history of Hirschsprung's disease. Managing inflammatory bowel diseases effectively with medications and lifestyle changes can reduce the risk of toxic megacolon. Avoiding chronic opioid use or working closely with a healthcare provider to manage constipation associated with opioid use is also important. Maintaining a healthy lifestyle, including a balanced diet rich in fiber and regular exercise, can promote healthy bowel function. The prognosis for megacolon varies significantly depending on the cause and the timeliness of diagnosis and treatment. With prompt surgical intervention, the prognosis for Hirschsprung's disease is generally good. The prognosis for acquired megacolon depends on the underlying condition. Toxic megacolon is a serious condition with a high mortality rate if not treated promptly. Recent research focuses on improving surgical techniques for Hirschsprung's disease, developing more targeted therapies for inflammatory bowel diseases, and exploring novel approaches to manage chronic constipation. Ongoing research continues to improve our understanding and management of Megacolon.